Today we will discuss about brachytherapy. Brachytherapy is also known as curie and is defined as a short distance treatment of malignant disease with radiation emanating from small sealed or encapsulated sources. The sources are placed directly into treatment volume or near the treatment volume. There are some advantages of brachytherapy, that's why we use. First, improved localized dose delivery to target. Sharp dose fall outside the target volume with better conformal therapy. There are some disadvantages of brachytherapy also. Only good for well localized tumors and for small lesions, and very labor intensive. Brachytherapy treatment outcome is affected by particular model used for source distribution in target volume, algorithm used for calculation of dose distribution, methods used for the determination of the source strength, dose rate and prescribed dose used in treatment. There are different type of brachytherapy sources like photon sources, beta sources and neutron sources. In photon sources emit gamma rays through gamma decay and possibly characteristics X-ray through electron capture and internal conversion. Examples are cobalt-60, cesium-137, iridium-192, iodine-125, palladium-103. Beta sources emit electrons following beta source decay. Examples are strontium-90 and yttrium-90. Neutron sources emits neutrons following spontaneous nuclear fission. Example is californium-258. Important aspects of any brachytherapy treatment are use of a stable dosimetric model for the treatment time and dose distribution calculation. Use of calibrated sources with the calibration traceable to a standards laboratory. Accurate positioning of sources to prevent geographical misses. There are different types of brachytherapy implants like intracavitary, interstitial, surface plate, intraluminal, intraoperative and intravascular. In intracavitary brachytherapy implants, sources are placed into a body cavity. In interstitial, sources are implanted into tumor volume. In surface plaque, sources are loaded into a plaque which is brought into contact with the skin surface lesion. Intraluminal, sources are inserted into lumen. Intraoperative, sources are brought surgically into or near the tumor volume. Intravascular, sources are brought intravascularly into a lesion or near a lesion. Brachytherapy classification with respect to treatment duration. Temporary implant, permanent implant. In temporary implant, dose is delivered over a period of time that is short in comparison with the half-life of the sources. Sources are removed when the prescribed dose has been reached. In permanent implant, dose is delivered over the lifetime of sources. The sources undergo complete radioactive decay. Brachytherapy classification with respect to source loading, hot loading and after loading. In hot loading, applicator is preloaded and contains a radioactive source at the time of placement into the patient. In afterloading, applicator is placed first into the patient and the radioactive source are loaded later either by hand called manual afterloading or by machine called automatic afterloading. In manual afterloading, generally the radiation sources are manually afterloaded into the applicators or catheters that have been placed within the target volume. At the end of treatment, the sources are removed again manually. After in manual loading and removal of sources from the applicators or catheters result in some radiation exposure to the medical and sports staff. In a remote afterloading is used to minimize radiation exposure to medical and sports staff. Several computer-driven remote afterloading systems have been developed. Use of remote afterloading machines offers several practical advantages over manual procedures such as increased patient treatment capacity, consistent and reproducible treatment delivery, reduced radiation exposure to staff. Brachytherapy classification with respect to dose rate. Low dose rate having a dose rate of 0.4 to 2 gray per hour. Medium dose rate having a dose rate from 2 to 12 gray per hour, and high dose rate have a dose rate of greater than 12 gray per hour. In addition to low dose rate, moderate dose rate and high dose rate brachytherapy techniques, another type of afterloading brachytherapy has been developed in which a continuous low dose rate treatment is simulated by a series of short duration dose pulses of the order of 30 minutes separated by intervals of 1 to several hours of no dose given. Technique is referred to as pulsed dose rate brachytherapy. Brachytherapy sources are usually encapsulated and the capsule serves multiple purposes like contains the radioactivity, provides source rigidity, absorbs alpha and beta radiation produced through source decay. Useful radiation produced in brachytherapy sources are gamma rays resulting from gamma decay, characteristic X-rays resulting from electron capture and from internal conversion, characteristic X-rays and bremsstrahlung originating in the source capsule. Dosimetric characteristics of brachytherapy sources are photon energy, half-life, half-value layer in shielding material, specific activity, source strength, inverse square dose fall off. Photon energy of brachytherapy source influences penetration into tissue, radiation protection requirements. Dose distribution in tissue are not influenced much by photon scattering for photon energy above 300 kilo electron volt because the attenuation in tissue is compensated for by scattered build up dose. Tissue attenuation is very significant for low photon energy of the order of 30 kV and below. Over a dozen radioactive nuclides have a history of use as shield sources in the brachytherapy. The common contemporary sources are cobalt-60, cesium-137, iridium-192, iodine-125, palladium-103. Less common sources are gold-198, ruthenium-106 and californium-252. Use of radium-226 and radon-222 was discontinued because of safety concerns. Sources are used as sealed sources, usually doubly encapsulated in order to provide adequate shielding against alpha and beta radiation emitted from the source, contain radioactive material, prevent leakage of radioactive material, and provides rigidity for the source. These are some radioisotopic source with average energy, half-life, half-value layer, and form of use. Thank you.